Bismillahirrahmanirrahim. Assalamu alaikum everyone. Quote of the day. Allah understands our prayers even when we can't find the words to say them. Today I'm presenting my journal club under supervision of my professor Dr. Saramsar. I would critically appraise the article titled as Socioeconomic Factors Associated with Stunted Growth Among Children Aged Under 5 Years in Faisalabad, Pakistan, according to STROBE checklist. This is the snapshot of the STROBE checklist, which I'm going to follow. Now, abstract of the article. The study aim is to identify socioeconomic stunted growth factors among under 5 years children in Faisalabad, Pakistan. The prevalence of stunted growth is a serious public health issue worldwide, including South Asia, and Pakistan is reported as one of the highest levels of stunting prevalence in children as compared to other developing countries. The prevalence of child stunted growth in Pakistan is still very high, but unfortunately, little is known about the associated factors. A community-based study was carried out with 400 respondents, pairs of mother and children between under 5 years of age, and to select the study participant, sample of a sampling technique, that is multi-stage sampling technique, was used for data collection from the community. And then children anthropometric measurements were taken to determine prevalence of stunted growth, and structured questionnaire was used to collect the information about socioeconomic associated factors with malnutrition. For the data analysis, version 23 of SPSS is used. Multiple linear regression analysis was used to find the socioeconomic factors associated with stunting among children. And study results indicated that contributed socioeconomic factor towards stunting are number of children under 5, childbirth size, household food security, hand washing practice, feeding colostrum to newborn child, exclusive breastfeeding, dietary diversity, and basic food groups. Now, introduction. Worldwide, undernutrition is still determining a silent emergency in policy concern that arise as a result of alarming health problems, especially in Southeast Asia. Now, who is stunted child? Any child whose height is less than -2 standard deviation from the WHO standard. That is considered as stunted child. In 2018, globally stunted growth continues with an estimated 149 million of children under 5 years of age, and more than half of under 5 children live in Asia. The results of Pakistan Demographic and Health Survey 2017 to 18 describe that 38% children of the total are moderately stunted. In Punjab, children are moderately stunted, that is 29.8%. So a body of literature emphasizes nutrition-related factors on childhood undernourished associated between several infections, including malaria, pneumonia, diarrhea under 5. Although in literature, multiplicity under nutrition is low height for age that also causes stunting. These studies consisted on undernutrition to find the associated factors stunting, which are multi-level and multifactorial, and that directly linked with individual, household, and community dynamic in relation to height for age. So it is very important here to examine a range of factors and measure the level of influence on children's health under 5 years in Pakistan, with a view to informing policy development. Objectives of the study: to measure the incidence of stunted growth at age of 5-year children, to evaluate the socioeconomic contributing factor towards stunting among under 5 years of children. Now, method. It was cross-sectional community-based research that is carried out through multi-stage sampling technique. The study was conducted to determine factors associated among children at the age of 5 in Faisalabad district, and every child was 0 to 59 months old, that is under 5 years of age. And his or her mother or caregiver was identified through a standardized random sampling process, and it involved the study by door-to-door visits. And then the district of Faisalabad consists of 8 towns. So the study was carried out with all 4 Faisalabad district of rural towns. 8 union councils were randomly selected and 2 villages were randomly selected. So this is how cluster sampling was done. Then determination of sample size. It was calculated of a single population proportion equation with 95% confidence level and 5% of margin of error, and approximate proportion of stunting 38% according to, that is height less than -2 standard deviation from the standard among children below 5 years. So the estimated sample size for the stunting prevalent children was measured relatively, which was around 362 to 400. it was so taken. The structure questionnaire was designed on the basis of the research from the relevant literature, and the questionnaire has been translated into local language Punjabi. For data collection, the structure interview guide was used face to face from respondents. Anthropometric measurements. Measurement guide was drawn by the Food and Nutrition Technical Assistance Project to the measurement of height and weight with age in children by using standardized anthropometric measurement procedure. Weighing scale with light clothes were used, and height was measured with stadiometer port from top to toe of the head with position Frankfurt position touched the stand line at 0.1 centimeter. And children recumbent length was taken at the age 6 to 23 months, and standing position height was measured after onwards. And each child's age gathered from their mother. All measurements of anthropometry are occupied by 2 times calculating and recording with the 2 measurements average. Statistical analysis was done using SPSS version 23. WHO Anthro software was used to examine the child that was stunted or not stunted. International criteria was used for anthropometric classification. And in the study, dependent variables were stunting and non-stunting were categorized as 0 and 1 respectively. And to identify associated factors of child stunting, multiple linear regression was used. And in order to identify degree of correlation among independent variables and results, both odds and confidence interval was used. P-value of less than 0.05 was deemed statistically significant to announce a test. So these are the results that is showing prevalence of stunted children among males and females. Here we can see that a total of 42.4% of the children were stunted, out of which the males were, there were 36.5% of the males were stunted and 48.7% of the females were stunted. And this is the table showing the socioeconomic associated stunting factors, which were calculated by multiple linear regression. It was found that the number of children at 5 years, child birth size, household food security, hand washing practice, feed, colostrum to child, and exclusive breastfeeding, dietary diversity, food groups, these all were found to be significantly associated with stunting. So these are the discussion and results. I would not go into the detail due to time constraint. So conclusion, prevalence of stunting is very high in Faisalabad. The results show that stunting associated factor was number of children under 5 years, child birth size, household food security, hand washing practice, feed colostrum to child, exclusive breastfeeding, dietary diversity, and basic food groups. Recommendations. Our study conclusions suggest that the stunting might be reduced if stunting contribute integrated interventions implemented to improve household, community, and personal level. Effort for birth spacing is very important. Struggle to reduce poverty to include food security, strengthen community level activities to enhance for hygienic as hand washing practices to prevent children from infectious diseases. Awareness and community-based nutrition campaigns should be conducted to promote feed colostrum to newborn exclusive breastfeeding. The awareness programs regarding nutritious food should be introduced and must be affordable at household and community level by the government by participation and contribution of NGOs to fighting the challenge of children under nutrition at the age of 5 years. So this is now the critical appraisal according to the STROBE checklist. First is indicate the study's design with a commonly used term in the title or the abstract. So yes, a community-based cross-sectional study design was mentioned in the abstract. Providing the abstract informative and balanced summary of what was done and what was found. So abstract provides a balanced summary, informative summary of what was known and what was found. Again, background is very well explained. Rationale 2 is well elaborated. Objectives are very clearly defined. However, objective number 1 is not justified by the authors, as it is mentioned that that the first objective is to determine the incidence of stunting. However, in community-based cross-sectional study, we can determine only the prevalence, not the incidence. So study design, it is present. Setting locations of data collection are mentioned. Participants give the eligibility criteria and the sources and methods of selection of participants. Unfortunately, exclusion criteria is not mentioned. However, participants selected through multi-stage sampling technique. Outcome variables are defined, but predictors, potential confounders, and effect modifiers are not mentioned. For each variable of interest, give sources of data and details of methods of assessment or measurement. Yes, very well mentioned. As the socioeconomic factors were determined through face-to-face questionnaire interview, and the measurements were taken through standardized methods. Bias, describe any efforts to address potential sources of bias. Bias is not mentioned, and how to deal with it, nothing is mentioned about the bias. Study size, that how it was arrived is very well mentioned. Quantitative variables, explain how quantitative variables were handled in the analysis. It is not mentioned. Statistical methods, describe all statistical methods, including those used to control for confounding. It is not well mentioned. Describe any method used to examine subgroups and interactions. Not mentioned. Explain how missing data was addressed. Missing data was avoided using face-to-face interview. And if applicable, describe analytical methods taking out of sampling strategy. It is not used. Then participants reports number of individuals at each stage of study. For example, number of potentially eligible, examined for eligibility, confirmed eligible, including the study, completing follow-up analysis, analyzed, not addressed. Descriptive data give characteristics of study participants like demographic, clinical, and social information, exposure, and potential confounders. Only social demographic factors that were assessed as contributing factors to stunting were mentioned, and there was no information, exposure, and potential confounders. Indicate number of participants with missing data for each variable of interest. It is not mentioned. Outcome data, report number of outcome events or summary measure. Yes, it is very well mentioned. Main results, give unadjusted estimates and applicable confounded adjusted estimates and their precision. So it is not mentioned. There is no use of flow diagram, and other analysis like analysis of subgroups and interactions, such analysis not mentioned. Key results, summarize key results with reference to study objectives. Yes, well summarized. Limitations with potential biases are not mentioned. Interpretation of results considering objectives, limitations, multiplier analysis, result from similar objects, and the relevant evidence are given and discussed. However, limitation is not discussed. Generalizability discussed. Funding, there is not mentioning of any funding sources. So coming to the strengths of the article is very well written, concise, grammatically correct, title is clear, accurate, and ambiguous. Abstract offers a clear overview of study, including the research problem, sample, methodology, finding, recommendations. Introduction provides sufficient background information along with rationale of the study. Target population clearly identified, sampling technique mentioned, operational definition was given, appropriate variables were chosen for answering the question. Table were presented in clear fashion complementing the text. Findings were linked back to the literature review along with recommendations and way forward. So weaknesses of the article are as follows. Exclusion criteria was not well mentioned in the methodology. Ethical consideration was not mentioned. Flow diagram was not given to show the final selection of participants in the study. Confounders and test to control confounders were not mentioned. Funding was not addressed. Bias was not addressed. Limitations of the study were not mentioned. So this is all about the critical appraisal of this article. And this is the YouTube link of the presentation, and thank you.
Assalamu alaikum.
Walaikum
Thank
salam.
you. Thank you so much, Dr. Maya. It was a very nice and elaborative presentation. I would like to add few points. Starting from the title. So it was brief and it explained the population that was targeted. Abstract was good. Later on, the objective was also mentioned, but as you have highlighted that there was mentioning of incidents, so you have already mentioned it. So main focus today is on the result section and the statistical analysis portion where multiple linear regression was used. So here we could see that they have been measuring height and in terms of stunting and using multiple variables to see the association. So in such cases, we use multiple regressions, but two things that were missing from their result section was first, the graphical representation was lacking. There were no scatter plots or any kind of graphical representation to show the linearity of the associations. And Secondly, you have mentioned bias. So whenever we are using multiple regression models, we mostly face, like in terms of confounding, sometimes we use the term confounding when you using other statistical methods. Here we use multicollinearities. So like if the independent variables are related, have multiple relations with the dependent variables, so it has not been addressed, and for that we calculate the correlation coefficient, and it's like Cronbach alpha. So 0.8 it's its value, and if it has to be significant, so it so has to be close to that value. So these 2 points were not addressed, and the result section was also very simply compiled. So if they have added the clear explanation of the which independent variables, which were continuous variables, which were categorical variables, then the things would have been easily interpreted. So the interpretation of the results, how they are presented, is a bit difficult based on the absence of addressing the multicollinearities and absence of the correlation coefficients. Although these are the part of the logistic regression, but still we can address these points whenever we are using multiple regression models. So these are all the points from my side. Anybody who wants to add, you can add.
Assalamu alaikum, everyone.
Walaikum
Very nice,
salam.
very well presented. Your critical appraiser, Dr. Amber, has explained all the points in a very good way. But you all know this topic is very close to my heart because you know it very well. I'm working on this. So I was watching this. They address stunting and their method, which is entirely opposite and different from my uh, style. So it was a nice experiencing listening to the things, how the people address the same issue with the different dimensions. So overall, the deficiencies have been explained by Dr. Amber. So I don't have anything else to add in it. But otherwise, it was a good article and you presented it
Yes.
well.
And
Thank you
Dr.
for that.
Zadi, it would have been a good learning experience because you can see that how they have tackled this
Yeah,
um, this time, how they have measured weight for I mean height for age, like this. So this was a very different type of statistical analysis, and it is a new dimension that you can add to your thesis as well using multiple regression models. So the purpose of these kinds of articles is that so that you have other dimensions to add more statistical analysis other than chi-square, because
yeah,
sometimes we are confused that we cannot use linear regression if we don't have continuous variables. So this
yeah,
article here has a good statistical analysis showing that you can also use multiple linear regressions when when there are multiple categorical independent variables. So this was a very important point to be highlighted. So thank you
yeah.
so much. And
Thank you so much.
okay, Allah Hafiz.
Okay, Allah
Okay,
Hafiz.
thank you, Dr. Amber, Dr. Sadia. Allah
Thank
Hafiz.
you, dear. Allah Hafiz.
Thank you, ma'am.